Good afternoon. Thank you all for being here. As Kimberly just said, I think we all share the concerns that we've heard from our earlier speakers. Social workers have adopted a moniker this year. We're calling ourselves the bootstraps of Texas. And the reason we're using that is because we feel like there are so many communities and so many individuals in the state that need bootstraps, that need that extra helping hand to pull themselves up or to manage the situations that they're in. And right now, some of the cuts that we are seeing are an indication that many of these bootstraps are going to be pulled out from under people, and that the very things that keep them productive and make it possible for them to function in our state are going to be taken away. And that the state is considering a number of actions, a number of cuts in funding that will in fact cost more money in the long run than they will save. Social workers in the many areas that they serve in the state of Texas are deeply concerned about a wide variety of areas that are impacting our citizens. For example, social workers provide about 60% of all mental health services in Texas. That means that our community mental health centers, our institutions, are places where people receive assistance that allow them to continue to work and to function and to provide care for others in their community and their families. A lot of this money is going to be withdrawn, and we don't know where they will get these kinds of services in the future, whether it's mental health or physical health. You understand why these services are so vital, and social workers in the state are very concerned that by pulling this money that people will not be able to receive services. We also have many social workers in schools, and they do things like work on dropout prevention programs, suicide prevention, trying to work with families and children to make sure that they come to school and that they attend and they get their education, because that is such an important factor in them becoming productive citizens of the future. We work with our communities to make sure that schools are safe places for them to be. And so the whole notion of cutting teachers and other people within our school system is totally unacceptable. And we worry that the impact of this on our communities, on our families, is going to be devastating. Social workers work with veterans, with people coming out of the military who have issues that need to be addressed so that they too can return and be productive citizens in their communities. What will we do if there's no one to help them make that transition? What's going to happen within our families and within our communities if they have nowhere to turn? You probably are aware that social workers are very important in the child abuse and neglect area. Many people who work for Child Protective Services and in community agencies do this really important work to keep children safe, and where possible to keep them in their families and in their communities. If we start cutting all of that funding, what will happen to these kids? Will we overlook when a child needs to be placed in a safer situation? Will we turn our backs when children are being neglected? What will happen to these children? And the damage that happens when we don't do those preventive things can be lifelong, and it's going to cost much more money in the long term than in the short term. And we say that these cuts are very short-sighted, and we feel that in this, as well as so many areas, that our state legislators need to really take another look, a much more balanced approach, and not be short-sighted about what makes good sense for Texas families. We think that they need to look at other sources of revenue. Cutting is not the only answer for what has to happen in our state. There are people who need services, and we have a responsibility to all of our citizens to make our communities safe places for them to live. There's also discussion about cuts for the elderly, for people in areas of gerontology, long-term care, nursing home, hospice. Once again, what that means is if they can't access services that way, then where are they going to be? Are we going to allow them to sit on our street corners or outside our emergency rooms because they can't get care so that they can live comfortably and safely in their own homes or in a proper type of institution? It makes no sense. And so social workers who work in all these areas are very concerned about the people who are going to be impacted. Another area is criminal justice. Are we, again, being short-sighted, particularly in the area of juvenile justice? Are we going to incarcerate every child who makes an unfortunate, an unthought through mistake in their early life? Are we going to put them all in jail and lock them up and put them with people who are hardened criminals so that when they come out they're really good at being criminals? We think that makes no sense for our communities, that makes no sense for our children. It's a waste of their lives, it's detrimental to their families. And what we're really asking is that our state legislators just think through what they think they are hearing from the people in their districts. If you ask people in the home communities, do you want to cut schools? Do you want to shut down nursing homes? They say no. Community care, thank you. They know that these things are important, and when they elected these officials to cut, they maybe didn't realize what those cuts really mean. They say cut bloated government, but I don't think they mean cut vital services. And it's only through your being here today, standing up, calling your legislators, going in, making those visits, sending them emails, sending them letters, talking to your friends and neighbors and your home officials in your communities, county, city. These are the people who can make the difference. We are already seeing a shift in the thought process within these walls. And that's because of people like you who have come back again and again and said, don't do this. This is bad for Texas. It's bad for our families. It's bad for our communities. And we will all dearly pay a price at the end of it. I heard in a previous presentation a statement that I thought was absolutely on target. The man said that the budget that they are preparing right now is a moral document. It speaks to what we think about our communities and how we care about our people. And it is the choices that we make about whether to give people the necessary help. That doesn't mean take care of every one of their needs, but when they need help, do the sensible thing to provide the kind of help and care that they need so that they can be productive, tax-paying members of our communities. So thank you for being here. Please go back and tell all your friends, neighbors, family, they must stand up for what is right and good. They must protect our communities. They must protect the citizens of our state in order for us to be the greatest state in the union. Thank you very much.